Hi everyone, my name is Danyasha Williams. I am a CDA, and what a CDA is a certified dental assistant. I also work in the front desk. I've been in the dental field for 16 years. I've been working at this particular office that I am now for 2 years, but I've been working for the same dentist for 16 years. Excuse me. So I really enjoy what I do. I love talking about dentistry. I am a wife and a mother of 2 young adults. So I am also pursuing my career into becoming a dental hygienist. So I really, as you probably already know, that I really love dentistry, and I like giving people letting people know about your dental health and how to keep your oral health good, so that you can have a great smile, and the rest of your body can be in tune with your oral health as well. So today we are going to talk about oral health. And I'm going to just touch on one particular subject, because with dentistry, you can talk about all types of different things, because there are different things, in dentistry you can do. You can talk about fillings, you can talk about hygienist, dentist, you can talk about extractions, you can talk about a lot of things. But the one thing that I want to talk to you guys about today is about periodontal disease. And another word for periodontal disease is called gum disease, okay? And a lot of people don't know what periodontal is. So periodontal is actually, it's the ligaments that surrounds your teeth lining here. Okay, so those, sometimes if they become infected, or if you haven't flossed or anything like that, you can get some debris and you can get infection, and things that kind of makes your gums recede and things start to move. So the cause of periodontal disease is the lack of not going to your hygienist every 6 months for your cleanings, not keeping up with your oral health, meaning you're not brushing as you should, and you're not flossing as you should. And a lot of times periodontal disease can lead to tooth loss, because a lot of times when you get infection in between your gums, or you have what we call plaque or tartar that gets in between the gums that you can't get with just a normal toothbrush, that's why you go to your hygienist, so that she can use her tools to get up under the gum line to get all of that debris off from under there, so your gums don't become inflamed and you don't get any infections. So if you have infections, or you have debris under there that you can't get with your toothbrush, we have what you call periodontal disease, and it progresses along the way. And I'm going to show you one of my visual aids here. As you can see here, this is our healthy gums, and as you can see right up in here, this is your gum line, and this is just the ligaments that surround your tooth, that kind of keeps your tooth in place. So as you can see, this is very healthy, it's very pink, and that's what you want to see when you see your gum tissue. You don't want them to be inflamed, and you don't want them to be swollen. So this is a great illustration of a healthy gum tissue and the ligaments around the gum tissue. Now, if you look at this picture here, and as you can see, it says gingivitis. Okay, you see that it says gingivitis. So a gingivitis is one stage down from periodontal disease. So gingivitis is reversible. It's just a small inflamed tissues, your inflamed gum tissue. And so what happens is, if you don't floss, or if you don't floss and you don't brush at the gum line, you'll have plaque and tartar that kind of sits on your gums, and it starts getting kind of red and inflamed. Now, if you can tell the difference from these two pictures, this picture shows healthy gum line. This shows just a more pronounced gum, where it's a little reddened. And then we have what we call periodontal. Okay, it is preventable, as I stated before. As you can see, these little yellow specks, if you can see that shows illustration of having some tartar and plaque buildup, and your gums don't like that. If you have any tartar or you have any plaque that's right up under the gum line, we have what we call our gums start to recede away from the tooth because it's not healthy for the gums. They don't like anything that kind of sits up under there, and that causes infection, and it causes an infection and things of that nature up under your gum tissue. Okay, so the starting signs of periodontal disease is inflammation. Inflammation is one sign of that you have something going on in your gum tissue. And inflammation is when you have plaque and tartar up under your gums that you can't see and you can't get at with just a normal toothbrush. So that when you see that up under, when you brushing your teeth and you have calculus or if you have tartar under there, it's hard, you can't see up under there, and that's why you should go to your hygienist so that she's able to use her tools so that she can get all of that debris out of there for healthier gum tissue. Also, bad breath is another sign of having periodontal disease. If you have very bad breath, that means that you have some type of gum inflammation that's dealing with your bad breath. Also, loose teeth. When you have periodontal disease, anytime that you can take the top of your tooth and move it easily from side to side, that's how you know there's other signs of having periodontal disease, because you have infection that is have your gums are receding away from that tooth because it does not like the debris and inflammation that it's causing. Okay, so a lot of the risk factors of having periodontal disease is smoking. It increases pocket formation and attachment loss. That means the attachments around your tooth will become loose and they will come away from your gums. Also, poor oral health. That means it can lead to major health issues. Periodontal can lead to heart issues and things of that nature. Also, diabetes. Diabetes becomes, when people that have diabetes, they have poor blood sugar control. And so when you have poor blood sugar control and you got things going under your gum line, it makes it very hard to keep that under control. And so, periodontal disease can advance a lot of those things. The conclusions of this is benefits of keeping your oral health as your priority. Please keep your 6 months checkups. Please, just when you keep your 6 months checkup, it becomes you have a great smile, and it also, entails you just, feeling better about yourself. If you can smile with confidence and know and feel, and you feel good, and your body feels good, then it's more likely that you will feel good about your oral health and keeping it as a priority. If you go to your 6 month checkups as you need to be, or if you have anything going on as far as cavities or anything like that, it's best that you keep those and if we can find an issue before it becomes a big issue, then it's great. Okay, so with that being said, please keep your oral health as your priority. Go to your 6 month checkups, brush, floss each and every day, and your mouth will thank you so much. Okay, thank you so much. I appreciate you, and you guys have a great day. Bye.